Well, hello, Tamara.
Good morning, doctor.
What would you like done?
Oh yes, I have a huge eyelids. They're so huge. I hate them. And eye bags. They're very big. Can you please help me with this problem?
Certainly. That procedure is called a bleph, which is short for blepharoplasty. And what it involves is removing a lot of the excess skin and the underlying fat. Let me illustrate to you. Basically, in the upper lid, you have a lot of extra skin with the underlying fat, and the bags of the lower lid is a lot of fat protruding through. What the procedure involves is to remove the skin by making an elliptical incision and removing the fat that then pushes through underneath. With the lower lid, the procedure is done slightly different. Because of the tissue planes, I do the procedure from inside the lid. And what this involves is making an incision with the laser on the inside, which will then allow coagulation of the bleeding at the same time as cutting. Then the skin, the fat protrudes through, and I remove that.
What are you doing for excess of this skin?
Rather than removing it with the knife, as in the upper lid, I use the laser for laser resurfacing, and I actually resurface it with the laser. And the reason that works is because one of the side effects of using the laser is that it shrinks up the skin, and that's what we want to do here. We want to shrink the skin.
I heard you're using here different type of lasers.
Correct. For this procedure, I use both the carbon dioxide, CO2 laser, and the erbium laser. They're both similar in that they vaporize the skin, but the CO2 laser is much stronger, and that's the laser I use for cutting, whilst the erbium laser has a lower power, and therefore I use that for the resurfacing. The CO2 laser will cause a redness for about up to 3 months if I used it for the resurfacing, whilst with the erbium laser that only takes about 4 weeks before the redness goes away.
What will happen if your laser doesn't work?
I'll get a brick and I'll just throw it through my tubes. Do you have any questions?
Yes. Is the laser going to affect my vision?
The procedure is a procedure of the eyelids, not of the eyes, so it has nothing to do with the eyes. However, we do use protective plates on the eyeball to protect it from any stray laser beams.
Okay. Okay, when we can make this operation?
Well, we need to do some preoperative blood tests to check for HIV and hepatitis, and what I'd like to do is give you an information sheet which pretty much explains everything that I've told you, but take it away, read it through, contact us if you have any other further questions, and then we can work out a date for the procedure.
I'm Wendy. Come through this way. Into here. This is just where we change, and I'll show you what to do. Do you have any allergies? No. And you're not wearing any jewellery? No. Okay, this you pop on your head like mine. These go on your feet. If you're cold, you can leave your socks on, put those on. Everything else will fix. So what we'll do is I'm going to do your blood pressure, temperature, and then Dr. Schwartz will come and mark your eyes. My name is Sister Wendy Morell, and I'm Dr. Schwartz's assistant. Today I will take you through blepharoplasty, or lid surgery, with a warning that some viewers may find certain aspects of the surgery disturbing. The surgery commences with the administration of intramuscular sedation and analgesia. and infra and supraorbital nerve block is then given, followed by a subconjunctival local anesthetic. The incision is made with a CO2 laser inside the lower lid. The tissue planes are divided until the fat pad extrudes. The fat is then excised using the laser. The amount of fat removed is carefully assessed so as not to create a depression under the lid post-operatively. Once Dr. Schwartz is satisfied that enough fat has been removed, he commences the procedure on the other eye. Discomfort is minimal, with some patients complaining only of a feeling of pressure. Most patients drift in and out of a sleepy, relaxed state, enjoying the relaxed atmosphere and ambient music that prevails in our theatre. Once the lower lids have been operated on subconjunctivally with a laser, we begin working on the upper lids. The excess skin is carefully excised from the upper lids, first the right and then the left. Careful hemostasis is performed to prevent post-operative bleeding. The upper orbital septum is then perforated by the sharp tips of the scissors and the excess fat is allowed to protrude. The fat is then clamped and excised. Interrupted 6/0 vicral sutures are placed at the lateral end of the excision and the wound is closed with continuous subcutaneous suturing. This will ensure that no post-operative scar is visible. The sutures are removed after 5 days. You will recall that the fat was removed subconjunctivally, that is, from the inside of the lid. Now he will resurface the skin, which will cause shrinkage and also eradicate any lines or wrinkles. More local anesthetic is given to ensure that the process is pain-free. Here he is using the erbium laser to place the first of 3 passes. Note how the skin blanches. The purple tube on the left is a vacuum extractor. Held close to the skin and laser, its powerful suction removes the plume or waste vapors emitted by the laser. Subsequent passes are at right angles to the first one. He is now resurfacing the other side. Note how his assistant, that's me, protects the eyelashes and also observe the stainless steel caps which protect the cornea of the eye.